So I get a lot of questions about VA healthcare here in the Philippines. I think I've talked a little bit about it, mentioned it on a couple of things, but I haven't really ever sat down and just really talked in length about the VA and how I go about getting medical care here in the Philippines. So I thought this was a great time to do that. My wife agreed, and so she's my cameraman today. So every 6 months I go to the VA clinic in Manila, which is located near the U.S. Embassy Annex. We usually go down the night before, get us an Airbnb or something near MOA, which is right next to that area. And we, make an evening out of it, have dinner, walk around the mall, go to IKEA, whatever. And the next morning we get up and we go to the clinic. And usually they're very good about trying to schedule everything on the same day, 30 minutes apart or whatever. So about a week or so ago, I had my 6-month appointment, and I had my labs. Like, for example, my labs were at 11. I saw the cardiologist at 11:30, and then at 1 I saw the gastroenterologist, which is also my primary care, if you will, my coordinator for the team that I'm a part of there at the VA. And he kind of oversees my medications and makes sure that my prescriptions get renewed, that type of thing. From there, I went, scheduled my next appointment for 6 months out, picked up some additional prescriptions that the doctor had given me there at the pharmacy at the clinic, and picked up a couple of referrals, if you will, one for a 2D echocardiogram of my heart and one for basically an upper and lower GI. Having those two procedures referred to the doctor of my choice that basically takes what's called FMP. FMP stands for Foreign Medical Program. So anything I don't get done at the VA, anything I get done outside of the VA that is connected to my service-connected disabilities, which there's a lot of them, and pretty much any issue I have falls under that category. I don't think I've ever been to a doctor here in the last 2 years for something that wasn't connected to my disability. So the list is long. Anyway, these two they're tied because for heart disease and IBS and gastrointestinal stuff and that kind of thing. So where I go to get my FMP care, my Foreign Medical Program care, is here at Clark Medical City in Clark. I'm still kind of seeing how they do. It didn't start off real well today. I'll talk about that in a minute. But I came Monday, and I came to schedule the 2D echocardiogram and the upper and lower GI. The cardiogram, no problem. Got my paperwork, and there's an FMP office. It's in the concierge area here as you walk in the main entrance of the hospital. It's to the left past the reception desk. There's a little kiosk. You get a number. You put that you're there for FMP or TRICARE, whatever you're there for. For you TRICARE folks, they do take that here as well. I know I get asked that a lot, is TRICARE accepted? And it is. There are hospitals here in the Philippines that take TRICARE, and TRICARE has an international office. I believe it's in Singapore that if you're traveling internationally, you have to kind of schedule through, and they kind of take care of you from there. But they have selected hospitals that take part in their program as well. Other than that, I'm afraid I don't know a lot about TRICARE. I will in about 10 months because it will become my primary health insurance. VA will kind of be my secondary, so to speak. So, got my paperwork there at the FMP office. It's really, they're really good people down there. They take care of you very quickly, get your stuff. Gave them my letter from the VA. Came up to the cardio lab, scheduled my cardiogram, literally for 2 days later, or 3 days later. Then I went to my gastro. And I kind of got a little upset. They wanted me to make a separate appointment. Not an appointment. They don't do appointments here. Let me kind of tell you a little bit about that, because you need to know if you're a foreigner in the Philippines, and if there's anybody else doing it like we do in the U.S., I don't know of anyone. Every doctor I've seen here has done it the same way. They don't do appointments. They have like a 2 to 3 hour window that you come up and you basically you're queuing. So, you know, they give you a number, and if you're the 10th person to walk in the office, you're number 10. And you sit there for a long time sometimes. Many times well past the office hours, sometimes it takes. So not a very efficient system by any means. You have to be very patient. I have tried actually doing 2 different doctors in the same day. One had morning office hours, one had afternoon office hours. And the morning one bled over into the afternoon and ended up screwing me up on the afternoon appointment. So I spent here all day, got to see one doctor. So that kind of stuff can happen. It takes a lot of patience. But I didn't have any on this day. It should have been as simple as giving them the VA letter and the gastroenterologist then, you know, scheduling me for this procedure, because the VA is asking for it. They're not saying we want you to evaluate if he needs it or not. They're saying we want you to do the procedure. But I got a lot of pushback from the reception. Wanted me to come back the next day. I said, you don't understand. I don't live here. I drive long distances to get here. I'm not coming back tomorrow. So I just, I left, went to the next door to another gastroenterologist that I'd never met. And they were super accommodating right then, and said, absolutely, we'll take care of you. And got a whole different vibe and experience. So, you know, don't be afraid just because I've been going to this gastroenterologist for, you know, a while now. This particular doctor wouldn't even take FMP for office visits. I had to pay cash and then do a reimbursement, which takes forever for FMP sometimes. But it's so much nicer if the doctor will just do the paperwork and take care of it. But this other doctor does. So that all worked out. Decided for me to come back on Monday for an intake, which was yesterday. So came back yesterday, 1 o'clock, went right in. Nobody else ahead of me, didn't have to queue. They were waiting for me. Did my intake, went down, made sure there was they do that procedure. You know, it's an outpatient procedure in the U.S. I've had it many times. Here, they actually admit you into the hospital. The clean out process that you normally do at home in the U.S., they do it here in the hospital. And then in the morning, I will have the procedure. So that's why I'm here now. So today, Tuesday, we came in at 10. I had my 2D echocardiogram. And then we've been basically waiting most of the day. This has been where the things have kind of gone a little awry. We've been waiting since about 11 to be admitted to start the process for other procedures. We did not actually get admitted until 7 tonight. So we've just been kind of hanging out in Clark and Angeles for about 8 hours. There seemed to be some confusion with rooms and availability, even though we come and checked on all that. But bottom line is we got in. One thing we had to make sure was, you know, what kind of room FMP, the foreign medical program, will actually pay for. And it turns out they will pay for a private room. They have categories here at Clark Medical City. They said they will pay up through the deluxe room, which I have no idea what that is. And if the deluxe is not available, I guess they get taken fairly quickly. Then the next level up, which is so we got upgraded. Didn't use my Hilton Honors points or anything. So we're in an executive deluxe room, and you know, for a hospital room, it's not bad. It's got a little kitchenette, which I can't use because I got to fast tonight. It's got a little living room. Jim's going to sleep in. Nice private CR. Nothing fancy on the bed. I asked for a jacuzzi. I didn't get it, so I'm not sure what that's about. Something they do differently here, which I'm still trying to wrap my brain around. They do what's called a watcher, and I told Jen it sounds kind of like a stalker. But in order to do this today, to get admitted, I had to do an RT-PCR test, even though I've had 2 shots, 2 boosters, and had COVID. Good God, I don't think I could do anything else. But they made me do an RT-PCR, which you know how fun those are.
And you pay it out of your pocket.
Yeah, and FMP doesn't pay for that, even though the hospital requires it.
Remember how much?
So that's about 2,500 pesos,
Yeah.
I believe. That's about $50 for the RT-PCR. And once that came back negative, we had to bring it over to the hospital. But that wasn't what held up me getting a room. And for her to be the watcher, she had to get an antigen test as well to be able to be in here. And what a watcher is, she's explained this to me, is that basically the watcher does everything that the nurse would do in the United States. So far I'm not real sure what the nurses do. They took my blood pressure and my temperature and my weight and my height, and that's it so far. So we'll see. I'm assuming they'd be the ones that give me the IV, and but apparently my wife she's in charge of everything else. So that's a little different. Not used to that. You know, in the U.S. we just have a visitor show up every now and then when we're in the hospital. But she will actually stay overnight with me if I need help getting to the restroom or whatever. I won't be eating anything, so that's going to matter. There's my watcher.
Hi.
She's a little cold right now. She's using my towel to wrap up. So here we are. We're in the room, not exactly sure what the process is going to be, and got a lot of explanation. I know I'll have some lab work and so forth. But because all of these things that I'm having done are tied to specific disabilities that I have, FMP will take care of this. I don't believe there's any money out of pocket. I'll find out though, but I don't think there is. So that's it for the foreign medical program and for the VA in Manila. I will say that I believe the VA clinic here is the only one outside of United States and United States territory. I'm guessing it's because of the amount of expats that live in and around the Philippines. That would be my guess. But it is nice to have. I mentioned that in about 10 months I turn 60, and my TRICARE will kick in at that point. TRICARE for life, I believe, is what they call it. And I will have that for about 5 years until I turn 65, and then it switches over to Medicare. So, and of course the VA will always be there along the way. When I do go back to the U.S., if I need to have some things done, or for example, I'm eligible for dental and vision and all that other stuff, well, that's not available here. The clinic here is very limited on what they can do and the availability of services. I do have a cardiologist, I do have a gastroenterologist here, and there's some other specialties, but they very limited on what they actually do. They pretty much just oversee veteran care, from what I can understand, based on my experience. Back in the States, the VA hospitals, of course, are much more comprehensive. So if I ever go back and want to have some dental stuff done or whatever, I am eligible for all that, but I have to do all that stateside. I possibly could even jump over to Guam, which is a short hop from here. I believe there's also, I'd have to double check this, but I believe there's also a VA hospital there that has more services. I hate to say that because I don't really know for sure, but comment below if you know the answer to that. But that would be ideal, or even possibly Hawaii. I know Hawaii's got to have. There are some options without having to go all the way back to the continental United States to receive care. So those of you that are curious about that, there you go. You know, the things I've done up to this point, this is really my first big procedure, I guess you could say, here in the Philippines. I still don't know what kind of anesthesia. Got a lot to learn about that, but I'm hoping to find all that out within the next 24 hours, how that compares to the U.S. So, because I've had this procedure many times, it's been kind of a lifelong, well, as long as I've served, I've had it. So it's been an ongoing issue with me for many, many years. So I'll leave it there. If you guys got any specific questions, I do try to hit the comments at least once a week if I can, and I try to answer your questions. If I see there's a bunch of questions that I could have answered and I didn't, I'll do another vlog. But hopefully this has been helpful. There is options, guys, here for foreign medical insurance. I just can't speak to it. I don't have it. I've never purchased it here, but I do know it's available, and I've heard good and bad. It's like anything in the States. Insurance companies, there's some that are really good. There are some that are not so good. Some really expensive. Some not so expensive. And of course, the coverage kind of goes along with that as well. So, same thing here. I just can't say much else about that. I don't want to mislead anybody with information I don't have. But if you have some specific questions, ask me. I don't mind. I'm retired. I'll see if I can find an answer for you, okay? I'm going to leave it there. And me and my watcher are going to talk. Y'all have a good evening. One last thing. I just wanted to go on record as saying I don't really do pink. And I'm not super pleased about the color that was waiting for me on this bed when I got into my hospital room. Not my choice here, guys. Okay, so I don't want to hear any smart aleck comments about, oh, Baker, you look great in pink. And this, I don't want to hear it. I don't. My wife's lips look great in pink. I don't. And it's not me. But I just wanted to say that. I forgot to say that, and my wife said she could, fit that in there somewhere. All right, you guys, y'all have a great week, okay? The good. The bad. The Philippines.